And when did you become familiar for the first time with neuroleptic malignant syndrome?
For me personally, I think it's since this happened, and I've looked at the information from the, in the PDR and about the medication.
Why is it that you were reading the insert on Haldol?
Because that was one of those medications that the patient was on. And like I said, I wanted to be more familiar. I mean, I needed to know.
It was within a month after Angela's death that you looked at the PDR for the medication she was taking?
I would say within, yes.
Did you take any steps upon finding out that Haldol had a potentially fatal reaction to determine if the staff nurses on 14 West were aware of this neuroleptic malignant syndrome?
No.
Know if anyone made any effort after Angela's death to find out if the staff on 14 West was aware of the neuroleptic malignant syndrome?
Let me just object to the formal question.
No, I'm not aware.
Do you know if there was any type of educational program before Angela's death to educate nurses on the potential adverse reactions to neuroleptic drugs through St. John Medical Center?
No.
Ms. Nichols, would you agree that the policies and procedures of St. John Medical Center require that if a nurse sees a patient having an adverse reaction to medications, that she's required to notify the physician?
I will object to the formal.
I'm not sure that policy form.
Well, as Director of Adult Mental Health Services, are you aware of any standard operating procedure that requires staff nurses to notify the treating physician if the nurse observes an adverse reaction to medications in the patient?
I'm not sure of it in policy form.
Have you ever seen patients involuntarily shake so badly their bed was moving?
No, I don't. I just don't recall.
Would you agree that St. John standard operating procedure requires that a nurse report any adverse drug reactions to the pharmacist?
I don't know that policies.
Would you agree that the standard operating procedure for St. John Medical Center requires that a nurse report all adverse drug reactions to the clinical director?
I really, like I said, I don't know what the policy is.
Agree that if a nurse observes a patient having an adverse reaction to a medication, that St. John standard operating procedures require that they complete a hospital incident report?
That's not my understanding. But like I said, I'm not. You may have a policy that I'm not familiar with.
You don't have any reason to believe that Angela was manipulating her illness, do you?
Nor do I have any reason to believe she wasn't.
Are you aware of any requirement at St. John Medical Center that when a patient is placed on 14 West, that any type of treatment team be established to provide care for the patient?
Well, I'm unclear. I mean, we have a treatment, we consider the staff there the treatment team, but I don't know specific policy.
Are you aware of any requirement that family counseling be established for patients on 14 West?
No.
Of any requirement that a family conference be held and that family conference notes would be charted in the patient chart?
Not a requirement, no.
What neuroleptic drugs are you familiar with?
Well, and I look at Haldol falling under that. That's real, that comes to mind. I'd have to look them up and tell you. I know Thorazine and those drugs that we use to, for that purpose.
Do you have an opinion as to what caused Angela's profuse sweating during her hospital stay?
I've seen profuse sweating such as described in patients with psychiatric illness, such as catatonia. It's also possible that it was made worse or made more extreme by the addition of Haldol.
Indication in the medical record when you reviewed Angela's chart that she was having a toxic reaction to Haldol?
In the broad sense of toxic, we could include side effects. Toxic, if you included it in that broad definition, she was having side effects, but not side effects of high blood levels of Haldol.
And do you have an opinion upon the hospital and its staff as to whether or not they've reached any standard of care?
I believe that the care they gave was ordinary good care.
Where is it that you first learned about neuroleptic malignant syndrome?
In that original conversation sometimes.
Would be January of this year, 1992, when you first learned of the potentially fatal symptom of neuroleptic malignant syndrome.
That's right.
Are you aware that Haldol is reported in the product insert to possibly create a potentially fatal complex of symptoms that's referred to as neuroleptic malignant syndrome?
I'm not aware of that.
Have you looked up Haldol in the physician's desk reference? Are you familiar with the adverse reactions to Haldol?
No, just superficial.
Do you know the potential adverse reactions which are recognized in using the drug Thorazine?
I really don't know right off the top of me.
Do you know whether or not Thorazine can potentially generate the neuroleptic malignant syndrome?
Okay.
Are you familiar with the drug Prolixin?
I'm familiar with the name.
Are you aware that it is used as a medication from time to time on 14 West?
I've heard it used, heard the name in relationship to adult patients.
Do you know whether or not Prolixin can potentially cause the neuroleptic malignant syndrome?
No, I don't. I'm unaware.
Are you familiar with the drug Novain?
I've heard the name.
Do you know what the adverse reactions to Novain are?
No, I don't.
Are you familiar with the drug Mellaril?
Mhm.
How is it that you're familiar with the drug Mellaril?
The same as the others. I've heard that name in discussing cases or reviewing cases.
Do you know whether or not Mellaril can cause the potentially fatal reaction referred to as neuroleptic malignant syndrome?
No, I don't.
Are you aware of the potential adverse reactions to Stelzane?
No, I'm not.
Are you aware of any standard operating procedure at St. John Medical Center that requires nurses to notify a physician if they observe a patient having an adverse reaction to medications?
You're wanting to know if I'm aware of a policy?
Yes.
Okay, I'm not aware.
Are staff nurses expected to become generally familiar with the standard operating procedures at St. John Medical Center?
Yes.
Do you recall seeing any reactions to the medication Haldol when it was administered to patients at Children's Medical Center?
I don't remember.
At St. John Medical Center, are you familiar with any type of program designed to educate nurses on the potential adverse reactions to medications that they give?
No, I'm not.
What is your understanding of why the Joint Commission has a requirement that professional staff have 8 hours of continuing education each year?
I haven't ever really thought of that.
Are you aware of today, as we sit here, of any potentially fatal adverse effects from the class of drugs called neuroleptics?
I haven't been in Burns in a long time, so I really don't recall what they are.
What's your understanding of what EPS is?
It's extrapyramidal symptoms.
And can you tell me, Mrs. Gooden, what those symptoms are, please?
No, I cannot.
Have you ever seen a patient experience extrapyramidal symptoms?
Oh, I'm sure I have.
And in your recollection, when you observed a patient having those symptoms, what was the patient doing? How could you tell they were having the symptoms?
I don't remember any situation.
During the 5 years you were on 5 South, you don't recall seeing any patient having extrapyramidal symptoms, specifically, or just?
I don't recall specific symptoms. You know, it's been a long time since I was really with patients, so I really don't remember.
Were you with patients on 5 South as late as 1989?
Yes. They can take it.
In staff development, is it part of your job to be certain that staff members are fulfilling their educational requirements?
No, it's their job.
Who is it at the hospital, in addition to the individual staff member, if anyone, that would assure that employees are complying with that educational requirement?
Their supervisor, I would assume. I do.
And how do you let staff members know of upcoming continuing education opportunities when you schedule some lecture or seminar or
I send out
in-service?
a calendar.
And where do you send the calendar to?
I give them to all the supervisors.
And do you know what the supervisors do with the calendar? I might be confused about your job, Mrs. Gooden, and maybe that's why my questions seem unusual to you, if they do. Correct me if I'm wrong, I'm trying to get this right. Is it, it's not your job to know what's available, is that correct? By way of educational materials? It's only your job to know where you could go and find those materials.
That's correct.
And it's not your job to know the content of course materials that are given, or courses that are given. It's just your job to schedule and coordinate so those courses can become available on areas that nursing staff or supervisors want to learn about. Is that correct?
I don't know where all the different, each unit can provide in-services on their unit that I have no knowledge of. They don't have to come through me for everything they schedule on the individual units.
If a what do you consider to be a new development? What time period would be a new development?
I really haven't given it any thought.
Do you consider a new development a development that has occurred within the last 3 years? Would you? And what do you currently do at St. John Medical Center?
I'm a mental health supervisor.
During the time that you were involved in mental health services at St. John Medical Center from 1986 up through the present, have you ever had any course on pharmacology through in-service courses?
What do you mean by pharmacology?
My understanding is that pharmacology is medications and the use of medications at the hospital.
Not that I remember.
Do you agree that the St. John Medical Center written policy and procedures required that if a nurse sees a patient having an adverse reaction to medications, that the nurse is required to notify the nursing supervisor.
The policy and procedures require that they give the highest level of care that they can, and they have to use their judgment at that time. And that's all that I can say about that part of it.
Have you ever taken any steps to require your nursing staff to attend any in-service courses on medications and administration to medications to patients?
No.
Do you know if Clozaril is a neuroleptic?
No, not for sure.
Do you know what type of neuroleptic drugs are administered on 14 West?
There was only one that I know of. It is the Haldol.
Are you familiar with any neuroleptic drug at all other than Haldol?
Thorazine would be the only other one.
Can you tell me what the most common psychotropic medications are that are given on 14 West?
No.
Are you aware of any potential adverse reactions to Thorazine that could cause death in a patient?
No.
Do you know if a drug called Prolixin is given at St. John Medical Center?
No.
You don't? Do you know what the adverse reactions to Mellaril are?
It's been a long time since I've given meds. I'm not as familiar with Mellaril as I am the Haldol.
Are you familiar with the adverse reactions of Stelzane?
No.
As supervisor of 14 West, did you have any responsibility or duty to find out what events led up to Angela's death on August 11th of 1990?
No.
Now I'm asking if a nurse puts her initials on a 15-minute check sheet, doesn't the standard of nursing practice require that the same nurse make the entry on the 15-minute checklist as her initials indicate?
No.
Are you aware of any type of warning contained in the physician's desk reference of potentially fatal complications of Haldol?
No.
You never heard of a reaction to Haldol called neuroleptic malignant syndrome?
Not at that time, no.
When a patient dies on 14 West, when you were nursing supervisor, specifically talking about Angela, do you perceive that you have any duty to find out the events leading up to her death?
No.
Did you review the chart to determine if Angela had any signs of physical distress that might have warranted nursing intervention?
No.
Would you agree that St. John Medical Center standard operating procedures require that whenever a nurse sees an adverse reaction, that she's required to notify the physician.
I do not agree. No.
Do you agree that the standard operating procedure at St. John Medical Center requires that if a nurse sees a patient having an adverse reaction to medications, that the nurse is required to notify the pharmacist?
Would depend on the circumstances going on and the judgment of the nurse who is there.
Dr. Schwartz, would you expect that nurses on the psychiatric ward would be familiar with the side effects of neuroleptics?
Oh, yes.
As a treating physician, if you were treating Angela, would you have taken any steps to determine whether or not that muscle activity was a seizure?
I've discussed it with the nurse and with the patient to find out if the symptoms corresponded to a seizure or not.
And what questions would you ask to the nurse to determine that this muscle activity was a seizure?
Well, above all, what did you see? What was the time course did you see? Did the patient lose consciousness? Did the patient close her eyes? Did the patient fall down? Did the patient bite her tongue? Did she lose her urine? Did she show tonus and clonus?
Do you know if Dr. Soria discussed any of those factors with the nurse that observed Angela having muscle activity, and where she's indicated in the notes that there was seizures questioned?
I believe that Dr. Soria discussed things at great length with the nurses every day, and that whenever the nurses had a serious consideration in regards to the care of the patient, I feel confident from having read the depositions and the charts that it would have come up in conversation.
Your factual basis leading you to your understanding that Dr. Soria had long conversations with the nurses about their care of Angela Hyatt.
Well, he said that every day he spoke with the nurses and he read their notes. When my experience is that nurses don't hesitate to tell you about the problems that the patients are having, and that what went on at St. John's Hospital is not in any way different than that.
That one of the reasons that Dr. Soria considered ECT was because Angela was having such reactions to the Haldol.
No, I think he suggested ECT because Angela was remaining seriously ill from her psychiatric condition, and it was not responding to the Haldol sufficiently.
How about Mellaril? Was it a neuroleptic?
That, again, does not have, I don't know if it's called a neuroleptic or not, really, but I think psychotropic would cover the whole. Now, Thorazine and Mellaril don't have these particular side effects that we've spoken of.
Are you aware of any warnings in the physician's desk reference that Haldol is potentially fatal?
No, I don't think I was at the time of Angela's problems. Since then I have, wondered about, all different medications. But, no, I don't think I'd ever thought of it as being in that vein.
St. John Medical Center had never provided you with any training as to how to recognize any potentially fatal adverse reactions to Haldol had they before Angela's hospitalization.
No, we'd had in-services on Parkinsonian things, the EPS and that sort of thing, but nothing regarding fatality, I don't think.
Prior to Angela's hospitalization, you'd never heard of neuroleptic malignant syndrome, had you?
I may have heard of it.
Do you know what the abnormal involuntary movement scale is? Back at the time Angela was a patient at St. John Medical Center, you weren't aware of any signs and symptoms of anything called neuroleptic malignant syndrome, were you?
I wasn't, was I? No, I don't think that ever had occurred to me, truly, that there was anything of that nature. And again, I'm not that familiar with this syndrome either, so the only thing I can recall is with that symptomology, is there not a high fever? That seems like something that I don't know if that came from afterward or before, but
Have you read anything since Angela's hospitalization about neuroleptic
No, I haven't.
malignant syndrome?
no. That's why I'm so vague about.
Do you have any understanding as to what brings on neuroleptic malignant syndrome? What the cause of it is?
Well, I'd be guessing probably, but I would say high and consistent doses of medication. What else could it be?
What types of medication do you understand could potentially result in the neuroleptic malignant syndrome?
Honestly, I don't know, except for, you've talked about the Haldol, but I would think any of the other could produce the same thing if they're the same chemical basis, like Perlixin or...
Do you recall?
I don't know, honestly, but I shouldn't be saying...
Would you consider it an adverse reaction when someone's jaws are so stiff they can't eat solid food?
Adverse reaction, yes.
His muscles very tight. Was that is that an indication of rigidity when you say that her muscles are very tight?
I would think so. I don't know for sure, but I think that's what I may have meant.
Sometimes can the adverse reactions to Haldol mimic schizophrenia?
I don't think so.
In your nursing observations and experience and training, you can tell the difference between adverse reactions to Haldol and schizophrenia, can't you?
I would think so.
Are you aware of any policy at St. John Medical Center that requires a nurse to notify the attending physician when a patient has an adverse reaction to medications?
I don't remember that policy.
While you were an employee of St. John Medical Center, did St. John Medical Center provide you with any type of courses or training on their standard operating procedures?
I don't remember any specifics.
Are you aware of any policy at St. John Medical Center that requires a staff nurse to advise the pharmacy at St. John Medical Center if a patient is having an adverse reaction to medications?
No, I'm not aware of any policy.
Ever see patients that had their jaws locked up so tightly that they were unable to take solid food?
Not that I recall.
Did you ever see any patients having a crisis called apostatinus, where they arched their back very dramatically?
No, I've never seen that.
Did you ever see patients who were having EPS that would have a fluttering of the eyelids?
Not that I remember.
Did you ever see patients that were having EPS that were shaking all over while you were a nurse at St. John Medical Center?
No.
Are you aware of what the treatment is for a patient that is suspected of having neuroleptic malignant syndrome?
No.
During the time that Angela was a patient at St. John Medical Center, was she able at any time to talk with you and communicate with you?
I don't really remember having any specific conversations with her. In fact, I really don't remember actually taking care of her.
As we sit here today, do you know any of the adverse reactions to Prolixin?
I can't remember specifics.
Do you know the potential adverse reactions to Mellaril?
I could look them up in a PDR. I just don't remember offhand specifics about the drug.
Mr. Ward, during the time that you were employed at St. John Medical Center, there was never any training given to you on the use or administration of neuroleptic drugs, was there?
I don't remember.
What were you told verbally as to how you were to perform 15-minute checks for patients on close observation?
We were to walk into the rooms, check them, make sure they weren't using some device to harm themselves. Same time on nights, we used to make sure they were resting quietly, peacefully in their beds, preferably not on a floor or in a chair. Check, make sure they were still breathing and so forth.
In fact, that's what was required of you, is to go ahead and touch them and see if they were alive?
Yes.
Have you ever had any type of in-service course at St. John Medical Center in patient medications and pharmacology, Mr. Kaufman?
I don't remember.
When you perform a 15-minute check, Mr. Kaufman, what do you do?
I look at their chest. I look to see if their arms are cut or if they're hanging from the ceiling. And they're breathing.
And at 5 a.m., you knew Angela was alive, is that correct?
Yes.
My question was, Mr. Kaufman, was this entry on Plaintiff's Exhibit 6, made at 5 a.m. by you, where it says continued to sleep, based upon your personal observation?
Yes.
And you'd gone into the room,
Going through the door.
and you could see that Angela was breathing?
Yes.
5:30 a.m., did you determine that Angela was asleep in the quiet room?
To my satisfaction, yes.
And did you initial that?
Yes.
And did you see Angela breathing at 5:30 a.m.?
To my satisfaction, I did.
Mr. Kaufman, are you familiar with a disease or set of symptoms that's referred to as neuroleptic malignant syndrome?
No, I'm not familiar with
What's your understanding of what causes neuroleptic malignant syndrome?
it. I really don't have any real knowledge of it. I'm sorry.
Have you seen side effects from Haldol very often, Mr. Kaufman?
Not too often. No.
If Angela was given food between 11 in the evening and 5:30 a.m., would it have been noted on the chart?
The 15-minute checklist.
The purpose of having one employee record the patient activity and to also then check the time that patient activity is observed is to assure that the patient is alive and not in distress.
Yes.
One of your mental health technicians or other staff members go make 15-minute checks when you're acting as charge nurse, like you were on August 11 of 1990. You would expect at a very minimum that each of those staff members would make certain that Angela Hyatt or other patients were alive on the 15-minute checks, wouldn't you?
Yeah.
And were you satisfied that she was breathing clear up until 5:30 a.m. on August 11th?
I was satisfied, yeah.
Have you ever been to any continuing education courses that covered neuroleptic malignant syndrome?
I don't believe so.
When you were giving care and treatment to Angela back in August of 1990, were you aware of the neuroleptic malignant syndrome then?
I don't know.
Is there any question in your mind that it's a requirement when conducting 15-minute checks that you determine at least that the patient is alive?
There's no doubt in my mind that you should.
And in your opinion, would the standard of care exercised by a reasonable nurse practicing in the mental health field require a determination that a patient was alive while conducting a 15-minute check?
If at all possible, yes.
Do you recall attending any in-service courses on the adverse reactions to neuroleptics? nurse has an obligation to the patient to know the potential side effects of each medication that is administered?
Yes, if at all possible, she does.
Nurse does not have the obligation to inform the patient or the patient's parents of the potential known reactions. Is that correct?
I feel that's more of a doctor's responsibility.
A nurse does not have the obligation to inform a patient, or if a minor, the patient's parents, of known potential adverse effects of the drug given to the patient. Is that correct?
Yes.
Are you aware of any St. John standard operating procedure that requires nurses to discuss adverse effects with patients?
There may be, but I don't recall what.
Would you agree that if you observe an adverse reaction that a patient is having to a specific medication, that St. John Medical Center standard operating procedure requires that you notify your nursing supervisor?
I object again to that question.
Well, I'm not aware of that.
Are you aware of any standard operating procedure published by St. John Medical Center that requires a psychiatric nurse to notify the St. John's pharmacist of any adverse reactions a patient is having to medications?
I'm not aware of that.
Observed Angela lying stiffly in bed. Was it your nursing assessment that this stiffness was a reaction to the Haldol she was taking?
I would assume I did, because I see I gave some cogentin to her.
And you weren't prescribing cogentin because you thought that Angela's tremors and stiffness and perspiring was a result of schizophrenia, were you?
No, I assume I gave it because she was having some EPS.
Which was a reaction to the Haldol, is that correct? Your nursing note also indicates that you sponged Angela with cool H2O. Do you see that? Is that a treatment that is generally given to a patient if they would have hyperthermia?
Yes, sir.
When you administer cogentin IM for EPS, is there some time period that you expect to see a patient get relief?
It usually has a fairly rapid effect on the patient with relief.
Once you get, and when you kept this very close watch on her, did you observe any change in her physical condition after you gave her the cogentin?
I don't remember.
Likewise, your note at 7:15 indicates that Angela took ice chips. Does that mean that you were giving her something because she was thirsty?
I I did that to help her temperature, bring her temperature down. Wet her mouth.
Did the symptoms you saw in Angela at 7:15 on August 7th appear to be more than the routine reaction to Haldol?
No, sir.
You just thought that was a routine reaction to Haldol?
Yes.
Does St. John Medical Center have any standard operating procedure or policy that requires a nurse to describe to patients the adverse effects they're having to prescribe medications?
I'm not sure. Usually the physician will do that.
Nursing charting, generally, do you put the word very to indicate extreme or exaggerated stiffness?
Exaggerated.
From your nursing notes, seeing that Angela was too tremulous and too rigid to eat very much, would you say that the Cogentin provided Angela relief from the symptoms she was having from the Haldol?
I can't say.
Are you aware of any hospital standard operating procedure relating to the charting of the mental health daily patient care record?
Not to my knowledge, no.
Have you ever attended any type of course on neuroleptic malignant syndrome? Have you ever read any article on neuroleptic malignant syndrome?
Yes,
What article have you read?
in the PDR.
And when did you read the PDR on neuroleptic malignant syndrome?
I don't remember.
Would you agree that nurses have an obligation to advise their patients of potential adverse reactions to medications that nurses are giving that patient?
I think that's the doctor's function.
Okay. Are you aware of any standard operating procedure at St. John Medical Center that directs nurses to advise patients of potential adverse reactions to medications that they're being given?
I don't recall one specifically, sir.
How about Meloril? Do you know if Meloril is a neuroleptic drug?
I don't know specifically.
Compazine. Have you ever heard of the drug called Compazine?
Yes, sir.
Do you know if it's a neuroleptic drug?
I don't know what pharmacists or doctors put those drugs in categories specifically.
Are you aware of any other neuroleptics besides Haldol and Thorazine that are commonly given when they are prescribed and ordered by a doctor to patients on 14 West?
Not right offhand.
Can you describe what it was about your clinical evaluation of Angela that led you to the conclusion that she had dystonia?
She was
just very rigid and slept in a non-moving position.
Are you aware of any standard operating procedure at St. John Medical Center that requires a nurse to notify the pharmacist of any adverse reactions that are observed in a patient?
I'm not aware of one.
Would you agree that the muteness could be an adverse reaction to the Haldol?
I don't know.
Are you aware of any standard operating procedure at St. John Medical Center that requires a patient's temperature to be checked every 4 hours if their temperature is more than 99 degrees?
I don't recall right offhand anything specific.
When Angela was a patient on 14 West in August of 1990, did people routinely sign their initials before any entries were made on the 15-minute check for patients on close observation status?
Yes, sir.
And then after the patient chart was initialed, then would someone go back in and fill in patient activities?
Yes, sir.
And from time to time, it wasn't the person who initialed the 15-minute check. Other people would go back and fill in patient activities. Isn't that correct?
Yes, sir.
Also, there's an arrow pointing up and it says shaking. Does that mean increased shaking?
Yes, sir.
I guess, does that mean something different than just shaking?
Means like going from a tremor into a more violent shaking, increasing the amount or the intensity or the length, duration.
Did you have a concern that Angela might have been having a seizure then?
No, it was just for want of a better term. I couldn't think of anything at that particular time, any medical term that actually was descriptive. And I thought, rather than saying it wasn't a temper tantrum, it wasn't a fit, I didn't know. So I just put question. And I possibly could have put more correctly atypical seizure if it was, and I wasn't diagnosing, because that's not my function, but I wanted to flag it that something wasn't wrong.
In your treatment of patients who are receiving Haldol, do you ever see them shaking so badly their beds are moving?
I don't recall specifically that happening before. I think that's why I used that as a description.
Since you're hiring, have you ever taken any test at St. John Medical Center about your knowledge of medications that you generally administer?
Not that I am aware of.
Have you ever been required by St. John Medical Center to take any type of course in pharmacology since the date that you've been hired?
Not that I recall of.
Under the description of the body, there's also something that says rigor, and you have put complete under that category.
Yes, sir.
Did you check Angela's jaws and try to open them and find that her jaws would not open because of the rigor?
Yes, I did. I tried to see. I would try to move her eyelid. I tried to move her jaw. Rigor mortis will come on from basically from the top of the head down to the feet, and when rigor leaves, it comes out. It leaves the same way from the top of the head down to the feet. And I basically checked her head, her neck, her arms, and her legs to see if they were. And in my opinion, at that time, they were in complete. She was in what we call complete rigor mortis.
Did you find Angela to be cold to the touch when you felt of her?
I deemed her to be what we consider room temperature. And that's the way it felt to me at that time. I did not do an actual temperature of her.
And when you say room temperature, that's based upon your experience in dealing in situations like this?
Right. Once a person dies, the body begins to cool down. And when we say it's cool or cold, usually when we say the body is cold, it means the body's been in a refrigerator for quite a while. Our morgue at the hospital, our office, she was not in a morgue. She was still in a room, and the body had a gradual cooling period of whatever room temperature was at that time.
Would you say that a fair estimate of room temperature at the time would have been 80 degrees or less?
I would say it's less than that, because it was during the summer and it was warm, and I imagine air conditioning was on. As to what degree, I don't know.
So, in other words, she had cooled down to the point where she would have stabilized at room temperature, is that?
In all likelihood, yes, sir.
Saying that when you found her, she was literally stiff from head to toe.
Yes, sir, she was.
She had no movable joints, as I understand it.
No, sir, she didn't. Like I said, when I turned her over, she was, from the position she was in these pictures here, would be just 180 degrees over. She'd be on her back, and her arms would still be in the same position that they are in these pictures underneath.
When you turned Angela over, wasn't it difficult to move her because of her arms being in rigor mortis?
Well, you take the sheet, we unloosened the sheet in the whole bed, and we pulled it like this, and then someone stood behind her, and we just basically grabbed a leg and an arm, and we pushed her over onto her back, and her arms were still like this. And when my service got there to take the body, we then pulled her arms down to her side so that we could take her out of the hospital.
Again, could you demonstrate for us when you rolled Angela over from her stomach to her back, how her arms appeared when she rolled over on her back?
When I first found Angela, she appeared to be laying like this on the bed, as the pillow would be right here, and her arms like this, flat, or what we call supine, or prone. I'm sorry, prone. And then when I turned her over, we pulled her over towards me, and another person stayed behind her so that we wouldn't flop her onto the bed, but just gently lay her onto her back. And as we turned her over, she was still with her head turned to an angle, but she was up with her arms like that.
Is there any type of scale for you to follow in determining when a patient's involuntary movements are severe, or when they would constitute an adverse reaction?
If after 30 minutes they have no relief from their symptoms after giving the PRN medication, then you would consider that they were probably in adverse reaction state. Adverse reaction.
If you suspect that there's an adverse reaction, according to your understanding of nursing practice and St. John's standard operating procedures, would you be required to notify a doctor if you suspected an adverse reaction?
Definitely.
And when you say that you wait 30 minutes and see if a patient gets, I believe your words are no relief, that you would...
If you give the medication and within 30 minutes, if there's no signs, if there's any kind of relief from the symptoms, then you would be concerned and call the doctor to tell him that there was no relief and what did he want done next.
Ms. Hooper, this 30-minute standard that you told me about, where did that come from?
Probably mine. No, usually any kind of medications you give, you should see a full benefit from it within 15 to 30 minutes. Like you're given a pain medication, you should have relief from the pain within 15 to 30 minutes, depending on the patient. That's in the PDRs and all that.
Generally, out of the 10 or 12 patients that would be on 14 West, and I'm using that as an estimate too, how many of those patients would be receiving Haldol on an average week?
I would say approximately half.
Would you agree that the acceptable standard of nursing practice requires that if a nurse recognizes that a patient is having adverse effects to a medication, that the doctor must be notified?
Yes.
Do you agree that if a nurse recognizes that a medication is harmful to a patient, that the acceptable standard of nursing practice requires the nurse notify the doctor or hold the medication till the doctor can be notified?
Yes.
Is it important in making proper nursing assessments and diagnosis that the nurse be aware of any type of previous reactions to medications that a patient may have had?
Yes.
Why is that important?
So you can compare them. If anything else comes up, then you'll know have a basis to compare with.
And what type of basis was provided the nursing staff to compare the reactions that Angela had had before coming to St. John?
If she'd had a reaction to one medication from the teeth procedure, she might have a reaction to something else that she was getting from our unit.
Before Angela was a patient at St. John Medical Center, were there any courses available to you on the neuroleptic malignant syndrome if you wanted to attend them?
Not that I can remember.
Recall any other staff member having to attend any specific course after Angela's death?
No, I can't.
You ever taken any type of test at St. John Medical Center relating to neuroleptic drugs and their adverse reactions?
Not that I remember.
If a nurse recognizes that a patient is having the symptoms that go into making up neuroleptic malignant syndrome, does the acceptable standard of nursing practice require that nurse to hold medications and notify the doctor?
Yes.
Would you agree that the acceptable standard of nursing practice requires that nurses know the potential adverse reactions and complications to medications that they routinely give their patients?
I don't know how to answer that.
After Angela's death, was her care and treatment discussed in any type of educational program?
No.
Are you aware of any in-service courses that were offered to the staff of the Mental Health Division of St. John Medical Center on neuroleptic drugs?
Yes, sir.
Are you aware of any course offered to the staff in the Mental Health Division at St. John Medical Center on neuroleptic malignant syndrome?
Yes.
Are you familiar with a symptom complex called neuroleptic malignant syndrome?
Yes.
As part of your role in staff development, continuing education, to ensure that nurses have a knowledge of potential reaction that patients might have to drugs that are given to them?
Not to ensure it, but to provide the educational offering.
Are reactions, adverse reactions to medications considered a nursing problem? Why is that?
That's a medical scope.
Sometimes it calls for you would be in charge of a shift.
Right.
And you were how old then?
20.
And your kids were how old now? 9 to 17?
9 to 17.
When you worked your shift, how many other personnel would be on duty besides yourself?
Depending on the number of children, it would be 2 or possibly just 1 more.